to complete current item, cabinet member would need to complete the current item, and then we've got the cabinet member question. So that would actually need to start before 10 o'clock. After 10 o'clock, it would need to be deferred. Can we not do an extension to the process?
You can. I mean, just the Constitution says that basically, if you want to continue past 10 p.m, you have to pass a motion to complete the current item that you're on. So if it's after 10 o'clock, then there's a sort of cut-off. You know, we complete this item, and then so I mean, it's sort of, if we do want to do cabinet member questions, we'd need to commence that before 10 o'clock. Is my advice.
So that's really helpful. So we're going to whip through the rest of no, we're not. We're going to just take this, but we are going to have to speak to Councillor Desneves before 10 o'clock. Otherwise, she's going to have to be deferred to another meeting. So I'm sure she doesn't want that, or maybe she does. So Councillor Desneves is going to ask the question that all you wanted to comment back on.
Chair, it's your meeting, not mine. So I'm here just to do the work. You know, well, I mean by you all, not mine. I just would say you're right, Sue. That's right. That is our job. And you're right. I was going to credit the chair and say, G and I do meet every month, and sometimes she says to me, "I heard this," and the people here on this side can attest that I meet with them weekly, and they hear all about the cases in my inbox, the things that people write to me about. But I also think there's an exercise in when I go out. I might visit the local parish priest who tells me about what's going on in his community. I might do a roving surgery in a school, and then in some things I might bring straight to a one-to-one, or other councillors do that too and tell me, and I might share that. And some of those things I also bank, and they're in that filing system, and we'll be sitting in a meeting about a relevant service and what have you, and that will be when I share those relevant things. So I think it does happen. We can only speak for ourselves. I know that councillors come to me with their cases that they're most worried about. But I also think you're right, there's a role for members' inquiries and logging and understanding. And we're going to have complaints, aren't we, coming to OSC soon? So that's also a place at which we discuss that sort of thing.
That record keeping of the informal learning and that informal service improvement, plus those lesser heard voices.
So I think we've picked up about the members' inquiry and capturing the concerns raised, and I think that's a really good point that's come out from that. So I think that's going to be really helpful for scrutiny. I am going to move us on to the last page because we've got 9 minutes in which Councillor Desneves is going to have to speak, otherwise, you know, that's kind of not going to happen. So we've got the commissioning team should look at widening provider choices for aids and adaptations to provide alternative options when delays or other problems occur. We've got the update on that. Are there any specific questions on that slide? Being really quiet now. I've given you a deadline. Okay, so I'm just going to ask, with the commissioning team, is this actually, are you able to commission enough services to sort of fulfil this?
Well, just to say that in terms of the NRS contract, as that kind of commentary says, we kind of got a few challenges around it, but we are tied into that as a kind of London-wide consortia. Have we got enough? That's a good question. I think what we're trying to do at the moment is work with our very newly appointed category manager in procurement to look at how we could maybe widen choice, but I will have to come back to you on that because I haven't actually come to any conclusions. Is that okay?
That's helpful, actually. It's good to hear that, and it's good to know that we're going to gain some feedback on that. So that's really helpful. Okay, so we've made a number of recommendations this evening. I want to thank, in particular, officers. I know, Karen, you're quite new into this post, and so thank you very much for coming along. So I did it again. Mrs. Leveson. I know. Particularly yourself and your husband for coming along, obviously here online and you in person. Again, it's really helpful. It really does give us a sort of real life sort of background to what's actually happening. So I do appreciate that. And actually a lot of what's been said this evening and recommendations, I think, have been quite heavily based on the information that's come out from this evening. So it is appreciated, and I hope you feel that your voice has been listened to in this process at this point. Okay. Well, I'm glad you didn't have your mic on for that. Okay, so thank you very much. Okay, Councillor Donovan, very quickly.
Yes, but it's actually on the last bit, which is the AIDS and Adaptation Policy 2024-27. When will that, I mean, it's draft at the moment, when is it likely to be agreed? Okay.
We're going to get a response back on that, a written response. So I'm going to close down this part of the meeting. We've got the recommendations from the meeting today. If any of the committee have anything else they want to add, can you email it to Dominic, and we're going to take that as part of the process this evening. And we're going to move on to agenda item number 9. Councillor Desnes is going to be very pleased we've made it in time, and on to Cabinet Member questions. So thank you to everyone that's been here for this, and obviously you can leave to go home. Councillor Desnes, over to you. Did you want to give us a brief update on anything of interest that you want to bring to us, and then we will be succinct in our questions so that you've got that opportunity to answer.
Chair, can I just very quickly ask, it's 10 o'clock and some of us have come straight from work to, and it's very late. Could we agree that we finish at 10:05 or something?
Well, this is hence the reason for asking very sort of brief.
Yeah, I'm just saying if we could, that would be fantastic. Thank you.
Well, it's down to members, to be honest, Councillor Mason. If you ask very long questions, but yes. So, Councillor Desnes, did you want? No. Okay. Has anyone got a question? I'm going to start with Helena at that end. Yes, I am. I'm going to ask Helen, have you got a question for Councillor Desnes? If you haven't, I can pass and you can raise your hand at the end if you need to. Okay, Ali, I'm just going to check and you don't have to respond, but if you, I'm just making sure that you haven't got a question for the Cabinet Member.
No, nothing from me. Thank you.
Okay, thank you so much. Councillor Brennan.
I think I asked my questions to you the other day, and I probably would have questions if I'd heard you talk, but next time.
I've got a very quick question, which is about Burgoyne Road, and because the Burgoyne Road was going to be changed, as you know, into a women's refuge, and it was due to replace 2 women's refuges in Hornsey, which weren't fit for purpose. Now, I don't know whether those 2 refuges have been done up, but they were in very poor condition when I last saw them, and I'm concerned that they just stay in a poor position and Burgoyne Road isn't developed. And the issue was, I mean, this is 4 years ago or something, 3 years ago. The issue was that the 2 houses are owned by Haringey and Hornsey Road and are huge, so would sell for 5 million or something, and the Burgoyne Road is now off the agenda because of the decision around capital spend. So it's not right. Okay.
No, that's not quite right. So Burgoyne Road, it's because we didn't. So Burgoyne Road's no longer sitting in my portfolio because it's now with housing, because as you know, we're housing homeless women there. Actually, the reason it's not on the agenda is because there was money coming from the GLA and that hasn't been forthcoming. That's the primary reason. So actually, the issue with Burgoyne Road well precedes the budget discussions. And I could do you a written response on what our refuge provision is looking like. That's kind of sitting a little bit between me and Vorg and housing, although actually Vorg related to the housing is sitting with housing. Do you sit on the housing scrutiny panel, don't you? Oh, I thought we did. Okay.
So I'll write to you and I'll ask you who.
But no, we'll do a written response. But I think it's sitting with Councillor Women's now, not my portfolio.
Okay, thanks a lot. Thank you.
Yeah, this is a big question, although I don't really expect you to answer it completely today. It's the sort of shocking news that we got a month or so ago that life expectancy in Haringey is one of the worst in London. There's actually the life expectancy has gone down, and it does seem to have some links to COVID. the way that COVID affected Haringey in particular. And I know there has been some work into how we were affected health-wise in Haringey, and it would be good to maybe get an update in relation to that, and what can be done. It comes to poverty, it comes to air quality, it comes to all sorts of things. It comes to actually the government's responsibility, probably. But it was a worrying statistic, because we thought things were improving. Thank you.
I mean, it is very, very worrying. Actually, what worries me most, some of you will heard me say this before, is actually healthy life expectancy and that gap, especially east to west. I think it was improving. Things are really difficult. And when we talked earlier and we had the deputation and we talked about finances, I mean, when we think about what people are living through in the borough and the poverty and then the impact of that poverty on their lives and their ability to be healthy, to be well, it's a big multifaceted issue. Some of us who are looking to a change in government are really heartened to think that the Labour Party, for instance, has said they'd come out and make England a marmot country and acknowledge the role of social inequality, social and commercial determinants of health in health. I think some of those things and so much more would go a long way to helping. Will, I don't know if you want to say anything on those topics.
Thanks very much, Councillor, for the question. It's obviously very much on our minds, the health of people in Haringey. Your question was about impacts of COVID, actually. So when we did the analysis of COVID death rates, of deaths from COVID in the pandemic, we actually we had relatively low death rates from COVID when we, in terms of our statistical neighbours. We were kind of we were in the bottom half in terms of death rates. So I think a lot of the work that we did during the COVID pandemic actually supported our residents. So I think that the broader picture we see in life expectancy is related to those issues around poverty, challenges that people face. And we see, I think, male life expectancy has gone down in particular and is now lower than the London average. Females not been affected so much. But yeah, lots of work to do. So I don't think it's the COVID infection itself, it's more the consequences, wider impacts of COVID and the wider impacts of, how shall I put it, I guess, lack of investment in the public realm and welfare reforms, particularly sort of 2010 onwards, challenges with housing, etc., and just the general pressures people face. But yeah, happy to come back and have a longer conversation on that.
And I think we should, but I did want to say one thing, which is that, of course, one thing we shouldn't ignore is the concept of long COVID, and we still have lots of people in this country living with long COVID. Of course, some of you know that my family was personally affected, so I always talk about it because I think we haven't, and I feel like we've got into a space where people are beginning more to talk about that long-term huge impact on people's lives. And I think you can imagine in communities that were more greatly exposed to risk, how that might have played out for them. And I also wonder, I notice, and this is something we could talk about in a future session. I haven't had a chance to chat to Will, but I noticed that some researchers and institutions are also just looking at that COVID and that impact on those multiple different health conditions and people's ability to their bodies, ability to cope and respond in the way that they might have done in the past in that post-COVID period. So I've picked up on some little bits of research that people are doing on that. So I wonder if that isn't in play here a little bit.
A couple of quick ones. First is if you have an update on Canning Crescent. And the second, this is for Will. What is the measles vaccine uptake in our borough, and are there any concerns, particularly given that there are outbreaks in the country?
Ward councillor, ward colleague, Canning Crescent is a tale of pain and woe, as I think everybody knows. And so what most recently happened is I signed a cabinet member signing decision to give the contract to an organisation so they could finish the job that our previous contractor couldn't finish because they became voluntarily bankrupt, etc., which is a bit of a theme for local authorities. It's something that lots of local authorities are seeing. So January arrived, and we then discovered that the contractor that we had signed with, which is an organisation that we've worked with, very respectable, had done this kind of project. Hard to find people who want to pick up a project that someone else has left halfway. We've done so much work, expended so much energy. They also made themselves voluntary bankrupt. So we find ourselves in the same situation. We don't have an answer at the moment. We're looking at, could one of the contractors that was working with that contractor, could it be, but we're at a point where we're having sensitive discussions about all of that. Why is it happening? It's happening because when all businesses, we are in a recession now, someone's deigned to confirm it to us, because the economy is in such a bad way. When businesses are struggling and they're overexposed in certain projects in certain areas, they will call voluntary voluntary bankruptcy, and then that cuts off their exposure. They will then continue to operate under another entity, and go off in their merry way. And the reality is, if we'd done due diligence on the day that we'd found out that they were doing that, the due diligence would have passed. That's what I'm told by our officers in procurement. So there's not a lot that we could have done. However, what we have talked about is, because this is an issue that other local authorities are facing, what can we do? Is there anything? And the team are looking at that. But it's a hidden, I feel, a really underreported, under-discussed thing. It's not in the press, but that because it's taking up so much resource in our team, just reworking everything, reworking that project, doing all that work, and then finding themselves in this situation again. So it's very distressing, frustrating, and a feature of our economy being completely on the slide.
Okay, I've got a couple of questions. Oh, sorry, Will, on measles.
So just on
No, measles is very important. Apologies.
Just on measles, there was a concern about sort of national increase in cases, and we've seen an increase in cases in London, some clusters. Haringey hasn't been badly affected in terms of cases. Vaccination rates are low in parts of Haringey as they are in London, and we're doing work to improve it. I sent a briefing round to all councillors, which I'll recirculate, which had some of the figures. And then the previous question, it just reminded me, we did our annual public health report towards the end of last year, which had some information on impact of COVID and some of those other things around life expectancy. I don't know if you're referring to that then, but I'm happy to send that around as well, and for information. Thanks.
So I might have missed that in the answer you just gave. So on the measles, are you doing sort of special catch-up, for people that have missed it, and maybe information within schools? Because I know that it got missed, during COVID. And
there's lots of different work going on, and that's sort of summarised in that briefing that I'll send around. But that includes information, comms campaigns, targeted catch-ups. So there's lots of things happening, working with particular communities as well, where the uptake is low, like the Orthodox Jewish community, for example.
Thank you. I was sure it was, but I thought I'd just give you the opportunity to add what you're doing. Okay, so I've got a couple of quick questions. Just because we obviously had the deputation this evening, my understanding is that the Osborne Grove nursing home or that process has been paused for 2 years and then to be re-looked at. And so that's what I heard, and I'm just checking that that's correct. And the other question that I just wanted to check, we've had some concerns around the use of associate physicians within GP practices in the borough. I know that there's been some significant concerns raised about that. I'm just wondering what's your thoughts on that, and if you've got any particular concerns within the borough on that.
So the answer is yes on Osborne Grove, and if we had more time, although it's difficult because also team at the group have left, but I hear what Helena was saying about co-production. We are actually we will be working with an external organisation, not just because of Osborne Grove, but just generally looking at how we co-produce, using best practice, thinking also about training and support for people who chair sessions or are involved in sessions, and we want to get the best out of that work. I know it's unfair because they're not here, but I would say that I don't feel entirely comfortable with what was represented earlier, and I wasn't able to say that, because we did go back to the co-production group mid last year and say, look, we're worried. That's why we didn't go to planning. We were ready to go to planning, and we didn't, because we're worried this project isn't actually financially viable anymore. So we did write to them, and at that point we did try and meet, and we couldn't quite get a date that enough people could get in the room that it made sense. Now, our bad that we then didn't pick that up in the autumn, because I think we then became neck deep in trying to dive into the budget. But I just feel like I wanted to put that on record. Physician associates, yeah, we did have a very sad case. We had a death in the borough, and I think we know what's going on. Healthcare is being rationed, and we don't have enough doctors. And Ty sitting next to you, so knows all about that. And so we, interestingly, I had a meeting today about physician associates. It does concern me. The thing that I've advocated most strongly for is that it's really important when you go into the GP practice, a resident, one should know who you're talking to. It's really important that you know, is it a GP, is it a physician associate, is it a pharmacist, really clear for you. And it's also really important because in cases we have seen, certainly in the case that, the tragic case that we know about, there are rules. People aren't supposed to be seen twice by a physician associate except under certain circumstances. So I wrote to the ICB with the concerns of residents and my own, and they have committed to coming back to Health and Wellbeing Board. But there are also there are some GP practices that have best practice on how to manage physician associates, how the oversight happens, how the supervision. So whilst most of us would say what we really want is GPs, we know where we are with that. We know what the problems are, and to discuss that here, the government are not doing it and haven't done it, and so that's why this role has appeared. And it doesn't mean that it doesn't have a role and couldn't work, but therefore we need the right kinds of oversight. So what I'm confident is there are some GP practices in the borough who have the belt and braces approach to managing it. So the conversation between us and the GP Federation will be about how we mainstream that and how we can help GP practices and primary care networks implement that good practice, keeping in mind that they are independent, and of course they're going to want to do the best practice, and of course they're going to want to follow government guidance, I would expect, but that they are independent and they have a different kind of structure than other services that we might expect things from. But yeah, I think it is a concern, but I feel like the ICB have heard some of the issues and are responding. But we'll hear back, I think this year we'll bring it back to Health and Wellbeing Board and understand what they're doing.
That's really helpful to have that update, so thank you.
Could I just celebrate one tiny thing? I just wanted to say that in the scheme of things, it's small, but it's on my mind because I had the data and I produced a report. Will and the team rolled out with our providers flu vaccinations in schools, and we had the highest rate in NCL, and in fact we're topping, better than some of the London-wide data, and that's really because there's some really deep, good work going on with schools, and I think that puts us in a really strong position to replicate and understand how we could do that with some of the other vaccinations that perhaps people haven't got. But I think that's it might seem like a small thing, but really important for our community's immunity, and it just shows that we've learned and we're using the right skills. So credit to the team, and there are lots of other positives, obviously, that I can't tell you about.
Okay, well, it's good to end on a positive note. I would just ask that you mentioned, and I won't ask you to expand on it now, but the information about getting did you say an independent organisation in to look at the scrutiny? That would be really helpful if we could, as a scrutiny committee, co-production, so I'm just getting too tired now. The co-production part, if we could get a report to us about what that is and how that is going to, when the time is appropriate.
Yeah, when we know, we'll. Yeah. I mean, it's part of much bigger piece of work that we're doing with the Joint Partnership Board around how we run our engagement and how we do it well.
Excellent. So we always need to know, or would like to know about that co-production part. So I'm just going to say that here. So thank you very much. That's the recommendation after the Cabinet member questions. I'm going to close this part because Councillor Mason did say it was needed to be swift. And we were quite swift.
Just wanted to very quickly say then, if you've got a second, is about the recent report of Haringey having the largest number of lowest paid workers in London. And I just think that is something that we should take cognizance of, because it is about people who are in part-time work, in low-paid work, and impacts on health and impacts on all sorts of other issues in people's lives.
Totally, and it also could be something that you talk about at OSC or at the committee that looks at employment and etc. I mean, it's very relevant for our work area, but it could be something that could be picked up there if it's not already being.
Okay, so before the committee rush off, there is the work programme that Dominic is going to very briefly update us on, and then it's, well, Helena, if you don't want to know about the work programme, you're more than, no, I'm being cheeky. So just very quickly, there's a meeting on Tuesday, so Dominic.
Very good point of procedure that we're not supposed to start any other items after 10 o'clock, but just say very briefly, we've got evidence session on Tuesday that Vicky's going to be updating us on the scrutiny review. So that's I'll send some more details by email tomorrow so that everybody's got information about what to expect.
Just a little reminder that was. So, and that ends the meeting. Thank you ever so much, everybody. Thank you.
Good night.